elbow. We've basically had varus in the wrist. We're going to have varus in the knee. And we're going to have varus in the ankle also when we get down there, okay? Except it's called something a little different in the ankle, that's all, okay? But it's essentially the same thing. So, make yourself comfortable. That means if you need to raise them, okay? Now we do both varus and valgus in full extension and about 30 degrees of flexion, okay? So full extension and about 30 degrees of flexion. So I'm going to come up close to her. I'm going to stabilize with my hip, her lower leg, okay? That leaves my hand free. I'm going to come in here, get as perpendicular to the joint line as possible, okay? So if her joint line is here, okay? So if that's her joint line, actually, that Parker cup, coffee cup, see it there behind the pelvis? Give me a black grease pencil. Okay, so that's her tibial plateau. So this is her joint line. Okay? So I'm trying to drive through the joint line. Okay? Come here if you can't see. So if I'm trying to drive through the joint line, part of my pressure is going to be here and part of my pressure is going to be here. So basically I'm gapping what part of the joint when I do that? Lateral or medial?
Medial.
Which way are you pushing from?
It's varus, so it's medial to lateral. So I'm pushing this way, so I'm gapping what part of the joint? Gapping the lateral portion, okay? As I gap the joint, what tension does that place on, tension is placed on what structures?
Lateral, collateral, medial.
Lateral collaterals, exactly, okay? So I keep her nice and straight. So my thenar eminence is up on her medial condyle. My hypothenar eminence is on her tibial plateau, okay? I want to drive right through that joint space. So if I'm looking for something to happen on this side, okay? How far do you take it? How hard do you push? This is the same for all joint testing.
Until you reproduce the symptoms.
Okay? It may be a little, it may be a lot, okay? If you push and there's nothing there, push more, go as much as they can handle, okay? And if it doesn't reproduce or exacerbate, okay, then that's not a problem. Then you can okay, mark it off your list, right? Okay? So, straight, right in through here. All I have to do now is with my fingertips is pick her up about 30 degrees. Okay? Now I'm going to support the femur. Now, a part of the screw home mechanism and some of the ligaments start to become lax in the knee, so you get a little more translation from medial to lateral in 30 degrees, okay? Because your passive restraints aren't necessarily, all of them aren't there, okay? So it's a good thing to do it both in full extension and about 30 degrees of flexion, okay? So, and notice how my forearm is. I'm as perpendicular as possible. I don't do it like this. That puts you at a mechanical disadvantage and you'll never be able to do enough tension if you need to, okay? Just go ahead and get in the right position right up front and you just gauge it based on patient's response, okay? Okay, so that's varus, right? Bow-legged, right? Okay? So if the tension is on the outside, what's happening on the inside?
It's drying.
It's closing down, right? Exactly. It's like a wedge, right? It's like this. So this area here is coming together. So I'm thinking, when I do this, I'm looking for stuff on the outside. I'm looking for those lateral collaterals. But what if they go, ow, it hurts where your hand is? Well, first I want to make sure just the pressure of my hand doing the test is not bothering them, okay? Other than that, and I may put a towel there. Still impart the force, but now it's padded more, okay? And they say, oh, no, it really still hurts in that area. Well, now I'm thinking something structural, right? So what have I got? Medial femoral condyle, tibial plateau, medial meniscus.
Could they have a bruise that you don't see there?
Possibly. That's why I try to disperse my contact over a larger surface area.
Okay.
Okay?
That would be the same, like, kind of feeling, though, obviously, because how would you differentiate that, like, if you can't see the bruise that well?
Like a bone bruise.
Yeah.
Well, then that's you mean like a bruise within the end plate of the tibial
I meant like
plateau?
on the skin, but what if you couldn't see it? Like it was like the skin color was too dark, or like maybe the bruises at the beginning of the phase. Or
Find out where it is and then go above and below it.
Okay. Be like, does it hurt here? Does it hurt here?
Yeah,
Does it
you're
not
going to
hurt?
palpate these. See, what's been excluded is actually, which predates your ortho, is palpation.
Okay.
Is your inspection palpation. Everything you learned in phys die, except I'm not going to auscultate her knee. I might, if I have joint mice, if I have a lot of arthritic conditions, crunching going on, I might put my stethoscope on and have them, bend and stuff like that, okay, to hear it.
Okay.
Okay, I'm not going to percuss. I'm not. It's dull. It's thud there. It's hollow here. Okay. So, you still have that. You still need to have that in your mind. That's probably the first thing you're going to do. You won't always do all of them based on where you're at.
Okay.
But inspection, palpation, okay? I always do that. I always palpate and inspect. So I kind of know up front beforehand before I
Okay.
get into the orthopedics.
That makes sense.
Okay, so valgus, okay? So valgus is going to be lateral to medial. I'm primarily looking at what? Medial collaterals, okay? And if that doesn't happen, then, we'll see what happens on the outside. The main thing for your varus and valgus is the collaterals on the opposite side. That's the main thing you're looking for, okay? So, come back in here. So there's my joint line, all right? Come in here, same thing. Thenar image is up on the lateral femoral condyle. Hypothenar image is in this tibial plateau over here, and in part over on the fibular head. The top of the fibular head's right in there, okay? So the head's there, the neck drops off in through here, okay? So I'm gonna be a little bit on the fibula. So you have to take that into consideration if there could be some fibular problems, okay? I'm gonna come in here, and I'm gonna drive straight lateral to medial. Okay. And then all I have to do is with my fingertips is pick it up. Okay. Again, stabilize it. And come across. And you'll get a little more motion. You can see her kneecap. Okay. All right. So that's varus and valgus. Okay. Primarily looking for your collaterals. All right, so let's just break for a moment.